Hamilton Public Health is looking into 2 COVID-19 cases involving people who have recently returned from a trip to South Africa.
This as the province says it's not looking to bring back restrictions despite the emergence of the new Omicron variant. The City of Hamilton's Public Health Department is now trying to determine exactly what they're dealing with.
They will go for whole genome sequencing. That's how we will determine whether or not they're a Delta case, a different variant, Omicron, etc.
The pair, along with close contacts, are all isolating. Public Health wouldn't say the route the 2 infected people took to return to Canada from South Africa and won't say what part of Hamilton the 2 live. Meanwhile, the province is tracking down 375 people who recently traveled to the 7 African countries that the federal government deemed as hotspots for the new variant. Health Minister Christine Elliott says the Ontario government is working to get increased testing overall.
We're also urging them to test people coming into the country regardless of where they've come from, because we're seeing that the Omicron variant is in several countries right now.
While the investigation continues to determine how severe the Omicron variant is, Ontario's Chief Medical Officer of Health says the province is in a better position now to deal with it compared to previous variants.
I think all Ontarians should be assured we've got good testing, surveillance, whole genome sequencing capacity, and because of that, we will continue to find cases.
The province says it anticipated an increase in cases as the cooler temperatures arrived. There were 788 reported today, but more importantly, Dr. Kieran Moore says hospitals are in a good place.
Length of stay for these individuals in the intensive care unit is getting shorter. There are younger people now in the intensive care unit, sadly, that were not vaccinated for the most part, but their recovery seems to be quicker and their mortality seems to be less.
Until more information is confirmed, Dr. Moore says at this point he doesn't foresee bringing back restrictions.
If it's a less lethal virus, less impact on the hospital sector, and our vaccines can continue to work against it, we will continue our current strategy.
But in the meantime, the province is looking to get more Ontarians a booster shot.
We're also looking at other age groups for the booster, the 3rd dose booster. We'll have more to say about this later on in the week.
Hundreds of thousands of Ontarians still haven't even received 1 dose of the vaccine. Dr. Kieran Moore says alternatives are coming down the pipe to protect them as well. He mentioned a non-mRNA vaccine like Pfizer or Moderna that he says may attract those who are skeptical still. He also mentioned that new treatments could become available in January. We'll have the latest COVID case numbers a little later this hour.